light, like see better. Yeah, I'm like looking at the TV like this. Yeah, the overhead light, they have like, yeah. They have their own program. That will happen. Makes me think. It's probably not reasonable, but what, it makes me feel. But, yeah, so I could turn them up. You know, so he was able to follow that. They were gonna make their way back to Washington and he did his thing.
Hello. 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 Hello.
Just because, no, just because, they want to mark off, more state. My oldest and Heather can say. She needs to be too, yeah. And then my younger one has more information, but yeah, so they both need it.
Hello.
So you're flying or I'm flying. Until Tuesday, and then I wanted, and it's gonna be out. And I'm like, let's come home 2 days earlier. I'm off Monday, Tuesday already. Okay. We could always use that.
We have 5 members in the audience. No. Hellfire won't be in attendance today.
You have Sutter Amador on there.
Not a committee member.
Okay. How many do we need for a quorum?
7, yeah.
Neat.
That's correct. So if you'd like, you can sit at the dais or next to us here. Okay.
No, you
so
come on up. You got to be about the rest of us.
one more.
Yeah, got to play the game.
Well, CHP was Todd Thibodeau, and he retired in December, and I don't think they've appointed him.
Amanda.
Is Bellotti available?
Is there an alternate?
I thought it was Matthew Sammons. Is that correct?
So you're out of Amador Hospital?
Public Health.
Public Health. But you're not the part of a committee member, or you are?
She is an alternate.
Then get over here. So then we.
Round 'em up, Jeff.
So we have 7.
We have 6.
I'm counting 7 people up here.
Okay. We'll have 7 shortly.
Yeah, we can. We've been
Thank you,
voting
Taylor.
that way.
Yes, the alternate. We have 2 board members sitting up here, and
And
as
as
an
a
alternate.
committee, we can be 2 board members. We're not a primary and alternate.
okay.
We get this stuff done.
All righty.
Okay.
Good morning, everybody. Now that we have established a quorum, let's go ahead and call this meeting to order. Wednesday, January 22nd at 10:07 a.m., the Emergency Medical Care Committee. And if everybody could stand for the Pledge of Allegiance, please.
I pledge allegiance to the flag of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with justice for all.
And, public matters that are not on the agenda, anybody in the public wish to speak on that? Or anybody on Zoom? Hearing none, we'll move on to the agenda. Need a motion for approval of today's agenda for January 22nd.
So moved, but, with an adjustment. We've got the, review and possible recommendation of committee member, the Mountain Valley Annual Report of Amador County Ambulance, but it's also, extending your, contract for 5 years. True?
The process is them to approve it here. It's the County Board of Supervisors.
Right, but it's, but we gotta forward it to the Board of
Right.
Supervisors.
Yeah.
Okay.
Yep.
Do we have a second? I'll second.
Motion and a second. Any further discussion? All those in favor?
Aye.
Any opposed? So moved. And item number 5, approval of minutes from October 22nd.
There was one minor thing that I made, found under Amador County Sheriff's Office. Other than that, I move to approve.
I've got a couple corrections. One, the agenda says October 22nd, the minutes say October 23rd, so we need to research which actual day that was. And then on the second page, the discussion of the backboards, where we had a motion, it all says blackboard. Those need to get corrected to backboard. And then under local CQI committee report, Mark Ferreira, he's the quality assurance coordinator, not the executive director. So those are the only corrections that I saw.
I amend my, motion.
Do you have a second?
I'll second.
Any further discussion? Those in favor?
Aye.
Any opposed? So moved. And item number 6, nomination of, election of chair and vice chair. So every year, first meeting of the year, we elect a chair and a vice chair.
This is where it really becomes crickets.
And if nobody wants to do it, I'll do it for the 12th year in a row.
Nominate Alan.
Thank you, buddy.
I'll do it for the 6th year in a row. Vice chair.
So I got a motion for myself as chair, Jeff Brown as vice chair. Do I have a second?
I'll second.
Thank you. All those in favor?
Aye. Aye.
Any opposed? So moved. Number 7 is, review of the bylaws. We went through these bylaws, last time these bylaws were updated was in 2009. And basically, we've reviewed the bylaws. We had a little committee, sat down. Currently, this board is comprised of 13 board members. There are board members on here like the local PD that I haven't seen in 12 years. ER doctor I have not seen probably at all in 20 years. CAL FIRE is hit and miss, and CHP is hit and miss depending on who their commander is. So there's a lot of vacancies that mess us up trying to get quorums where we only have a quorum 50% of the year. So cleaning this up, reducing it down, to having one ambulance provider, one representative from the hospital, representative from public health, representative from dispatch, one from law enforcement agency, and adding the local EMS agency. Those are the EMS players that should be on this, that I think. And also we changed the terms from 3-year terms to 2-year terms.
Go ahead and hit your button on the microphone.
fire departments.
The one that says microphone should be lit up red? Yep, okay. Yeah, and fire departments. That was about the only changes was the composition of the board and the
The only
terms.
thing I kind of laugh about is it doesn't have the Board of Supervisors on the board. So we can leave if you want.
Well, I need your vote to get rid of it. Well, we were trying to, you know, everything that we do is just a recommendation to the Board of Supervisors.
No, I understand that, but it is,
And if we added the board, now we're into an 8-member panel, and then, you know, I like to keep odd numbers on boards. But your call. If you want to add Board of Supervisors, we can add Board of Supervisors. I don't have.
well, I mean, okay, out of the 6 years I've been a voting member coming down here,
Huh?
so that's why I'm kind of, Frank and I have both been voting members.
Right.
You know, but we don't have it sitting here in the bylaws.
Yeah.
Probably should add it just because it's.
I mean, I understand what you're saying about an odd,
Uh-huh.
you know, an odd,
Right.
you know, thing, but,
Right.
you know,
I think it makes it legal too, more importantly.
Mhm.
Recommendation body, granted, but
So we'll add a, Board of Supervisor rep.
so you're looking at just two then, I mean, just one then, one board member.
Or,
For the two of us that are sitting here, you only want one of us here.
well, each agency will have a primary and an alternate.
Okay, so that's what you're looking for, okay. Because we have been voting as two of us,
Mhm.
you know, between Frank and I. Yeah. So that's the reason I'm just kind of curious about it.
Okay.
glad they accept the alternate position.
That's got to be approved by the Board of Supervisors.
Well, no, we did, that's what I'm trying to get at.
I'll take your
The
recommendation.
Board of Supervisors did put on a committee two, not a primary and alternate, but two.
Right.
So the Board of Supervisors already voted on that,
Okay, then we need to clean up the bylaws to
and that's,
reflect that.
I understand, that's what I'm trying to do right here,
Right.
right now.
Okay. Okay. So should we clarify that each position has a primary and an alternate seat in the bylaws?
Right, and do we keep the Board of Supervisors as a, because most committees that the Board of Supervisors are on is two of us. But not all. You know, and so that's something for us to, you know, if you want to keep a quorum type of stuff, or, you know, how do you want to run that?
So you want to keep all the seats as it is, but Board of Supervisors times 2?
Correct.
Okay.
Bylaws generally reflect current practices. Sometimes you amend them to change practice, but
Any further discussion? Any public comment? Correct. Correct.
Now, here's my, my reasoning behind it is he's my alternate for the actual Mountain County EMS. So if he doesn't know what the locally is wanting, that's where that education comes in as attending this meeting of what we're wanting, that I'm going to be pushing, you know, to Mountain County as a director. You know, and so that's the reason I'm pushing this to have both of us sitting here.
Just as a clarification, so every board member will have one vote, except for the Board of Supervisors would have 2 votes on this board, correct?
Correct. But as it's going, this committee is going to the Board of Supervisors. So it's not as if it can be overridden, you know, our votes by other board members of the Board of Supervisors.
All righty. Do I have a motion to approve the amended bylaws with the addition of 2 Board of Supervisors to the seats?
Since did the,
I'll make the motion.
request, thank you. I did not want to be the,
Motion by Gerton, I have a second. Who's that? Amber? Tracy. Any further discussion? All those in favor?
Aye.
Any opposed? So moved. Okay, review and possible recommendation of committee member applications, fire department districts. So Mike East was the primary for fire departments and districts, and he is no longer around, so we will be removing him. And Justin Yelnick was the primary seat with general public, so he's already been approved member from the Board of Supervisors, so we're just going to move him over into the primary seat of the fire districts. Okay. Anybody have any questions on that? All right. Mountain County's EMS agency, annual report on Amador County ambulance agreements. I believe Mr. Tom Morton has a presentation on that.
I have it up here. So while Heather's doing that, good morning, everyone. My name's Thomas Morton. I'm the acting executive director of Mountain County's EMS agency. So thanks for having us today.
Could you bring the mic over to you a little bit?
Okay. With me today is our medical director, Dr. Freeman, and our QI coordinator, who I guess didn't want my job, or you can have it. No? Okay, he declined. Mark Ferrer, who's our QI coordinator. So thank you for having us. I'm here to go over a contractual requirement that we have with the ambulance provider, ALA, to do an evaluation, an annual evaluation of the performance. It's in our contract. If you guys, I'm not asking you to put the contract up. So it's a big one, but it's in section 1.3 of our contract. If you guys want to go back and look at it later, conditions for extension of the agreement. If you're really interested in reading it, so there are conditions contractually, and this report is one of them. And there's 7 criteria contractually that make up this report that we provided, and Heather's put it up there. So if you're like me, you can't stand when a speaker comes up and reads the document that you already have, so I'm not going to do that. We'd be here all day, especially if we had to go through the whole contract. So I just kind of want to hit the high points and then come up with a recommendation at the end of going over this report. So the report that you have there is loosely based, as best we could, on the 7 criteria from the contract. That criteria, if you read the contract, I think the intent is valid, but some of the conditions, it's a little vague. So it's kind of hard to measure and put a quantitative stamp on. Just an example, what's the difference between 97% and 75%? Well, as a data person, it's huge to me. But in terms of performance, without criteria, how do you qualitatively do that? So what we did, you have for your reading pleasure, This is the report, right? No, this is the contract. What we put together for you initially is we just hit the high points of the statute and regulation that give us the authority to do this. Like you guys, we have a lot of statutory requirements. So we have a contract that was initiated January 1st, 2020 for 5 years. At the end of that 5-year period is an opportunity to extend the contract as is. So that's what we're going to talk about a little bit today. And the contract states that in agreement, there can be another, a 5-year extension that would go through 2029. So you guys know ALA, they're the stakeholder in the EMS system here. They provide ALS, BLS levels of service. They also provide what we call non-emergency services or interfacility transfer service under state regulations and guidance. They have an exclusive operating area, so they have exclusivity, which is a good thing to have. The state is actually reviewing statute and regulation right now at the state level, EMSA, and so it's a time of transition in EMS, but the idea that someone is grandfathered into this position is a good thing. It provides continuity, and ALA's been here a long time. Alan, I can't tell you how long you've been here because you've been here longer than me. But in this report that you have in front of you, there's some generalized areas that we're required to report to the EMCC on. And so I'm just going to kind of hit those at a high point. I'm available for questions afterwards if you'd like, but the report kind of speaks for itself. Response time standards. This is an area that in the contract there are response time standards. A lot of time historically is to be spent on response time standards. I will tell you that that's one of the things the general public always wants to know is how long does it take the ambulance to get there? That's the big thing. In the industry itself, we're learning that getting there the fastest, there's accidents, and we don't want those. And for every one emergency vehicle accident, there's 5 what they call wake effect behind them. So it's a big deal to get there on time for the patient, but we're also seeing clinically that some patients present in a way that it's not necessarily time sensitive. It's important to get there urgently, safely, but the time factor may or may not be a factor clinically. So there is some changes looked at in the system overall, but response time standards have been there forever, and what we're kind of finding is getting there faster is not necessarily the best thing. So we've been working with ALA. We recategorized or remapped the county using the U.S. National Grid system. That provides, in an emergency response, outside providers coming in to the county, not looking for an EMS customized map of grids and zones, but they're using the National Grid system. We think that's a big step forward. And once we've mapped with that standardized system, ALA and mountain counties have spent a lot of time going grid by grid, satellite view, so we can look at surrounding area. They're loosely based on the census data for population density, urban, suburban, rural, using those categories. And then we would assign a response priority, code 2, code 3, based on the category of that EMS grid. I think Alan would agree we spent a lot of time on that, trying to validate, making sure that, number one, the data is correct, that you don't want to have a population density that says urban that no one's there, right? So there was some quality on that. We've kind of, I won't say finalized yet, but we're still going through the final validation of those grid categorizations. Alan and I spent a lot of time last year going through them, and I think we've got one more run through to validate based on what the data is showing us before we'll sign off, but they've got to be appropriate. So we're working on that, but at this point that's been successful, and I think it's a really big step forward. We use a third party called First Watch that has a data interface with the Amador Sheriff's Office CAD, so we can get that incident data across that interface. It just makes life easier for us, and it's more efficient, and it's reproducible, which is important. We do the same thing in quality management. We have interfaces with we call it an ePCR, an electronic PCR platform. It's the software that the ambulance providers, first responders use to document patient contact, the evaluation, the treatment, the transport information. We use First Watch, their module called First Pass, again, a data interface directly to the PCR. We think this really enhances the QI process because we can sort and parse and filter data by rules on the back end so that the QI provider or the QI person for ALA, for the agency, and Dr. Freeman can actually have the data in front of them directly from the PCR. It's a big time saver, and we think that adds a lot of value. You know, Mountain County has changed as of July 1st, 2022. We moved our office up to Copperopolis. We don't have jurisdiction with Stanislaus County anymore. And I think one of the best things that's come out of that is now Mountain County
do a lot more training in the community, and with our EMS partners, with the ambulance and Tony in the back. So, little plug for that, for especially my fire guys too. It's their ask. We want to be involved in training, to assist in any types of that. So, Tony's just a phone call away. So I want to encourage people to do that. This was a huge success in Stanislaus County when we had it, and we're so grateful that ALA did donate this, because it provides a real, asset in terms of a training resource. We've had good collaboration, in terms of QI, in terms of training. In the report, you'll see a list of all of the community engagement that ALA has provided. I didn't put this in this report because I didn't want to speak without having it validated, but I think that ALA has an excellent relationship with the sheriff's office, and they provide some services to the sheriff's office in terms of blood draws and things like that. So another contribution that I do want to talk about with community engagement is ALA was very gracious in assisting the sheriff's office in purchasing, it's called Pro QA. Just a little quick education. When you call 911, that call taker at the sheriff's office has a medical interrogation script that's called emergency medical dispatch, computerized version. And ALA paid a substantial part of that initial implementation, and also pays the annual support and maintenance, which facilitates the dispatchers actually doing a quicker job in a standardized way. To you call 911, they determine what your complaint is, the priority to get there, code 2, code 3, and the level of service, ALS or BLS. So I think that financial investment in collaboration with the sheriff's office, I think it should be praised for what they did. We really appreciate it, and I know the sheriff's office does too. So I don't want to read through the whole report, but I really strongly encourage everyone here to read it. I think it demonstrates good faith, a great partner to collaborate with. I think we have good momentum right now. We all understand that EMS is dynamic right now. The whole system is experiencing a lot of change. But we feel very confident that we can work very well with ALA as we go forward to unforeseen incidents that come up. We're always, as a system, we're always looking to improve. ALA shows that same motivation that we do. And for that reason, we're recommending to the EMCC today that that you would vote to approve an extension based on contractual language and requirements. It has to be approved by this group for it to go to the Board of Supervisors for their final approval. So I could talk longer. I don't want to, but I'm happy to answer any questions. I didn't want to read this to you word for word. So if you don't understand anything or something's a little unclear, I'm happy to answer it. Otherwise,
I have a question for you.
Yeah.
So on page 25 of the contract, I believe it's section D and section E. So it talks about the contractor shall pay liquidated damages to Mountain Valley EMSA each and every month that the contractor fails to obtain response time compliance of at least 90%. So I'm not sure how much in the last 4 years or every month that's happened, but ALA is, very limited on resources. They have, 5 ambulances in the county. They do a wonderful and great job. But there's sometimes that they're just drawn down because of the amount of calls that's going on. And the county, obviously, as we know, is growing. And I just think that seems kind of unfair that if they hit 89 or 89.99%, they're going to be fined $1,000 a month. So potentially anywhere from $12,000 a year on up to $96,000 a year, which is in turn, that money's coming from the patients. And I don't necessarily agree with that. I think that's kind of wrong. If that was the case, I'd rather see that money go back into ALA so they can improve services. But giving it to Mountain Valley, And I'm sure it's been going on for a long time, but I just think that's unfair to have to find the community for services that are provided to them. So in essence, I mean, I live in the county, and if I need services and they're, you know, longer than what they're supposed to be because of what's going on or drawdown, or we have the county fair and resources are limited, we all know it happens. Potentially, if they're fined $1,000 for that month, that's coming from, you know, that's coming from money that I pay. And I just don't see, I'm just having trouble wrapping my head around why they have to pay that to you guys. That should be something that goes to them so they can improve the services. And maybe I'm just looking at it wrong, but that's just something that popped up.
No, you raised valid points. So the first thing I want to say is when this contract was implemented in the EMS industry, there was this trend, I guess you'd call it. They called it high performance EMS system, to where basically there was damages, fines, penalties for not meeting response time standards. That we've seen over time didn't work so well throughout the state of California. I can tell you that when I came into this position in, let's say, January 2023, up to that point, we had never imposed fines for a couple reasons. And one of them was we're still working through the data, because if you're going to find someone, you better make sure your data is validated, reproducible, and consistent and fair. I would agree. So in the terms of this contract, you see that whole section about liquidated damages. I can tell you that we've never, for the term of this contract, Alan, correct me if I'm wrong, but we have never invoiced for any penalties, because first and foremost, you got to make sure that they're accurate and fair and accurately reflect the contract requirements. So we have not imposed those fines ever. So we haven't been fining them.
Is that something that's still needed in the contract?
Well, I'm sure, Alan, we all have opinions about that. I will tell you this. I think that there has to be some kind of incentive for performance. I know that in the industry, that response time standards were the basis for those penalties. We're also seeing in the industry that response time standards, they are important, and I'll never say they're not. However, there's things that are more important, like maybe making sure you got the impression and evaluation and treatment. And so in the industry, we're looking at changing standards of performance and how you measure them. And part of that process is especially coming out of COVID, and the economy and inflation and such, that monetary fines, penalties, liquidated damages, whatever you want to call them, they can be effective, and they are effective. But in this EMS system, in a rural EMS system, one upfront has to make sure that you don't put someone out of business just because of penalties. That doesn't serve the community, because we've seen in California in the last couple of years coming out of COVID, ambulance providers just literally closing up shop. They're insolvent. They're bankrupt. They're broke. And Field of Dreams, remember that movie where they said, build it and they will come? If you had to go out and find another ambulance provider, there are counties in this state that can't find an ambulance provider that's willing to come into the county. So there's some real economic factors going on in the state right now. And putting someone out of business is poor patient care, right? You gotta have an ambulance.
If I may, I'd like to add something to this. I've been lucky enough to been on the Mountain Counties Board for 6 years now. But one of the biggest ones was before Stanislaus left. And they had one ambulance provider in Stanislaus out of 7. If I'm remembering.
5 or 6. We had
5.
Yeah.
But there was one ambulance provider that just flat out was not doing the job.
and everybody else was having to cover them. And that was the biggest, I mean, I would be surprised if ALA got called a couple times during that.
Probably if they were passing through the county.
Yeah, you know, because it was crazy, and that was the biggest thing, is this was a tool that we were having to use to say, hey, get your stuff together. You know, we're not trying to use it as and we definitely as a board looked at it like, come on, really? And so we don't want to use it as to kill an agency, but we want to have a tool to fix an agency.
Yeah, I get it. One thing, Justin, what we're doing today is recommending an extension to the contract. If we change the language, then we're opening the contract for all new negotiations, so. Maybe in 5 years, when we do open up for another 10-year contract, that we can change things.
That actually leads me to a question that I have.
Uh,
So I understand that this contract between the LEMSA and American Legion and Board of Supervisors, however, there is quite a bit of language in here that dictates how the hospital functions and how we transfer and transport patients. We've had several conversations about some of the issues that we're facing in the hospital, getting patients out or in. And typically the response is, well, that's how the contract is written. And here we are about to extend the contract for 5 years. And with no changes, with no significant changes and no solutions to the problem, to the problems that we're having. I guess one of my questions is, what is the opportunity for public input on this, Because this isn't just, and when I say the hospital, what I'm talking about is the patients in the hospital, the community members that are utilizing the hospital and the services of American Legion. I live here myself, my family lives here, we utilize the services of American Legion. I don't have any interest in seeing American Legion go away or losing their exclusive operating agreement, but I do have concerns about how this contract binds the hands of the hospital. Some of our.
Yeah, the contract is 90% a 911 contract, and we do interfacility transfers. So 911 is my first priority.
Okay, but
and we do have meetings coming up to discuss all this.
I know, but you're also talking about recommending this contract be continued as it is written.
Right.
And then you're saying we're not going to change anything for another 5 years over here.
Because it's an extension. If you start changing language, it's no longer an extension.
Okay, so so we have to wait 5 years at the hospital level as well? Is that what we're saying?
No, that is absolutely not what we're saying. That's not accurate. What we're saying is there by statute and regulation, there has to be an ambulance provider contract or agreement, a written agreement in place for ALA to continue. Otherwise, they can't continue service. And so there's a process to look at things. The first step right now is making sure that we don't have a break in service for our only ambulance provider in the county. So this is the first step. We are not saying that, like Alan mentioned, we are going to have meetings with the hospital, Sutter Amador Hospital, and their concerns and their challenges are being experienced by every other hospital in the state of California as well. So we are, as a system, trying to address it, but it would be detrimental to not to have a break in service. We don't have any other ambulance providers that are going to come up here in a short period of time. So we're asking for an extension to maintain the momentum. We have a meeting scheduled, Dr. Freeman, what's the date?
31st.
With Sutter Amador Hospital, ALA, ourselves, to talk about the challenges that are not unique, but they are important. They revolve around the highest level of interfacility service, the CCT, which is a scarce resource in the state of California. We have to get this resource from the valley, and that's a challenge, travel time alone, but just the number. So there's a process in place. one of the options in the next 5 years, based on the contract. I mean, you gotta read what the contract says about options to make changes to the contract. But we are not standing here today saying that we're not acknowledging opportunities, that we see the challenges that the hospital has, as does Mark Twain, as does John C. Fremont in our jurisdiction. We're having these conversations, quite honestly, with all of our providers because we see the systemic challenge that the hospitals have, that we all have had coming out of COVID especially. So we're not saying no change. That's absolutely not what we're saying. We're saying we need to maintain the current service. That's what we're here for today.
But I think what she was getting at was there's language in here that affects the hospital.
Right.
But they did not have an opportunity prior to look at this and then.
Have an opportunity every time we write a contract.
I don't know if they knew when the contract was being written. That was my
5 years ago when we wrote a contract.
Okay, as you've just said, things change. This community is growing, as are the resources changing at every hospital. To say that, well, 5 years ago, that's how it was written, so it needs to stay. Again, I'm not challenging your exclusive operating agreement. I am simply stating that there are things in this contract that do not serve this community. As was just brought up, our hands at the hospital are tied, even though we are not part of this contract. You say that interfacility transfers are only, I guess, 10% of your concern. They're all of the hospital's concern, because we're not calling 911.
So, well, I'm not gonna throw mud under the bus. And we'll save that till meetings.
So I would say this, I understand your concern. It's not being disregarded. That's why we have scheduled our initial meeting to have these discussions, because we are acknowledging the concerns. We are acknowledging the challenges. In statute and regulation, the designated LEMSA, local EMS agency, has the authority to enter into provider contracts according to EMS statute and regulation. That agreement legally is between the agency and the provider. To Alan's point that he made, I think, was that 5 years ago when this contract went out, it went out for public comment. So, and we also interview, when we go through this process, we talk to the stakeholders, we talk to fire, we talk to the hospital, we talk to public health. When we do a contract, we listen to the concerns right up front on the contract. Granted, it was 5 years ago. I think it is we were working on this report, it was really interesting. This contract went into effect right at the beginning of COVID, when COVID exploded. I can safely tell you that we didn't consider a pandemic, nor I don't think Alan or ALA did at the time, or public health or anyone else. We didn't consider that we were going to deal with a pandemic. And then when it finally resolved, we're digging out of a lot of stuff. We've learned a lot of stuff about the hospital and how the hospitals do things, how fire and everyone. So there's been a big learning curve. There's been a shortage of staff. I know that's happened at the hospital as well. ALA experienced it. I do want to compliment them. They were really proactive with recruiting during COVID for a lack of staff, so that was great. But we're recovering in terms of staffing now, finally, and training programs. So yeah, there is a lot of change, but there are opportunities in the process to look at the challenges in the EMS system. And us as an agency, we've always done that with all the stakeholders, and that's not going to change. So I think it's premature to sit here today and say that there's going to be no changes. We don't know, we haven't discussed this as a group yet with all the stakeholders. And I think, like it or not, there's no magic bullet. There's no, there's an ambulance shortage still. And so we're working through that, but it starts with conversation and it starts with collaboration. And that's what we're starting. And we're doing it with good intent to try to resolve stakeholder issues and challenges and barriers. But I can't give you an answer today, unfortunately, because we don't know all the concerns yet. I mean, they all have to be quantified, number one. And we as an agency, Dr. Freeman is a clinical director, evidence-based medicine. So we hope in our discussions that when people share, that they're providing the data or the information to support what their conclusion is or what point it is they're making, because that's what we as an EMS agency need. We need facts, we need data. So that's kind of the process on how we want it to go forward. It's frustrating for everyone. I'll acknowledge that. You probably can hear that in my voice. But there's a lack of resources out there. And bottom line is we want to get our patients to where they need to be for the highest level of care, appropriate care, in the most timely fashion. But we also have to address the data and the facts and try to come up with a solution that's beneficial to the patients first, and then to the rest of us. So that's kind of where we're at right now.
I understand that. And I am very aware of the meetings that are taking place. I'm just trying to understand the fact that we're just pushing contract through as written. Without,
We're pushing a contract to make sure that there is an ambulance provider for the county. And then there will be opportunities and possibilities after that, according to the contractual language. But we're here today, again, to make sure there's no break in service. And then we're looking forward to achieving some.
The one thing you're not saying to her is this contract can be amended. And that's,
What's the reopener process?
Well, that would have to be in the contract, and I'm not an attorney, so I'm not gonna speak to those possibilities. I would have to have our legal counsel.
right, but any contract is amendable.
Yeah, and I'll be clear, we're not saying it's not
What's the
amendable.
process?
Right.
Today is
And
not
that's
the
just,
day.
I think that's what she's really looking for is
yeah,
is
that
being
is what I'm
able.
looking for. I'm looking to be told that I'm not gonna have to wait 5 years to have these conversations again.
I apologize if I didn't make that clear. There's a process. One of the options is opening the contract. That's not the discussion today, though, that's all.
And, you know, and I would like to bring it up is that as one of the people that would forward this on to Mountain County EMS, I haven't had that conversation either. Nobody from Sutter Amador has come over and said, hi, we've got a problem.
So, I'm relatively new in this role. The person that held it before me had to reinvent the wheel. Essentially, the person that had it before her was just gone. And then it was during COVID, which my understanding is this was not happening very much during COVID. I don't know. Again, I was not here during COVID. But at this point, I am in the role and I am becoming aware more and more of the roadblocks that we're facing at the hospital level of patient transport and patient care.
But it's, you know, but as we're talking right here,
Mhm.
you know, I haven't had that conversation, you know, and I've
February
talked to.
31st, we're having a meeting if you would like to join us.
But what I'm really trying to get at, you know, is I've had communications with your CAO, you know, quite often, and he had brought it up to me. So, you know, so out of all of this, it's all our, you know, we're trying to make it all work. But right now, we're just trying to get this forwarded, and then we need to have some more communication, which I have no problem with. You know, because it's.
And we don't either, Supervisor Brown. We want to talk about it. That's why we pushed to get this initial meeting going. And I will tell you, during COVID, transports were a humongous issue getting patients out of the hospital.
Sure,
So,
listen, I did work as a nurse during
Yeah.
COVID, just not here.
yeah, but it was tough. It was tough times, and thank God, you know, knock on wood, it doesn't happen again.
Again, this is not like a challenge to the care that American Legion is providing, it is strictly how the contract is written. And like I said, I think I don't have a problem. They are an incredible resource to our community. It's not the sense, I'm not asking for any of that to be taken away. I just we have some challenges because of how the contract is written that we need to address.
I understand that, and that's why we started the discussions to address those, so. That's really all I can say about it. So did I answer your questions about that? It's, the EMS world's changing. I mean, like I said, right now at EMSA, they're reviewing like everything, in terms of regulation. It's been a long time since they've done an update on EMS regulations, and there's a lot of changes going on. And there's a lot of stuff that's going out to public comment. So I would encourage you all, if you want to see what's potentially coming down the road, go to the EMSA website and just, I don't know if you can subscribe to updates on regulations and stuff, but there's a page that shows all of the stuff that's out for public comment. And I would encourage the hospital, public health, everyone to look at EMS is changing, and we have to address the future going forward because it can't continue the way it is. It's just, there's just a lack of resources. Things do have to change, but EMSA is looking at it too, but that's going to trickle down to us as well.
I have a couple of questions, and maybe, I'm sorry, I'm new, I'm just
That's
trying to get my arms around this and like everything else right now. But I know from my district, Mill Creek State Prison's there, and one of the concerns I encountered on the campaign trail was how does a prison impact response times? Because I know where the location is there in town, but the farther you get out, I travel 88, 104 quarter on the regular, and so I constantly see how the prison impacts our community. I'm not sure how that's addressed. They probably could fund a whole ambulance themselves when I'm seeing just.
They do. They fund one ambulance.
I'm sure they do.
That's why there's two ambulances there in IM, right? One is almost dedicated to that prison, and we are out there
But it's,
1.5 times a day,
on
average.
but it's set up as a BLS.
But
the most part.
there's a BLS and an ALS.
Right, but BLS is normally what you pull out of there for the most part.
A handful, yeah.
Yeah.
So I guess my question to get more detail is it a positive or a negative response? As far as response time, is it a positive or negative? It's right there, but does that mute some of the response times elsewhere?
Not in the city of Ione.
No, I'm talking about like Comanche, the outlying areas.
Because that zone, like I said, is covered by two ambulances, and if one's tied up at the prison, it still leaves one there.
Gotcha, okay.
For that area. That's why we moved the second unit down into Ione.
I made that assumption.
Ione has the biggest growth in the county also,
Yeah, fair.
you know.
Yeah.
And then I will also say is that, upcountry, we only have one ambulance.
Right.
There's one ambulance from Jackson
to
to Kirkwood.
Tom mentioned about, some ambulance companies closing and stuff, and ever since COVID, I think in 10 years, you're gonna see major changes to ambulance companies throughout the state of California. Since COVID, there's been over 12 ambulance companies that have filed bankruptcy, and there's gonna be many more to come. If you look at our audit report that was included in this, last year we lost $350,000. The year before that, we lost $300,000. When you have operating expenses go up 34% since COVID and your income goes up 12% since COVID, there's an issue. We're going on year number 28 with Medi-Cal giving us 0 raise. 28 years without a raise from Medi-Cal, get $107.16 a transport. It is just ridiculous how the state of California treats us and how the government payers treat us. Obamacare did nothing for us. We're still running 7 to 8% uninsured. And now on collections, we can't collect on medical health care debt. Like, there's going to be major changes in the next 10 years if these California state legislators keep pushing their stuff.
I met with one the other day, I'll meet with her again, so.
Well,
address that.
I'm just very happy that Freddie Rodriguez is terming out and he will be bye-bye. This man has ruined the private ambulance company. He was in the EMT for AMR, and he's a very bitter EMT for AMR, and he was on a journey to ruin EMR.
I got one more question. Sorry if it's too technical, but as I was reading the contract, I saw where you talk about the mutual aid agreements. I assume inter-county, it's not a big deal, but when you get to the fringe of the counties, are there mutual aid, maybe, I'm sorry, I go too far in the weeds, but do we already have mutual aid agreements with neighboring counties?
We To my knowledge,
So-
we don't have any formal mutual aid agreements. I want to make clear one thing about the concept of mutual aid.
Sure.
Mutual aid is always voluntary unless there is a contractual agreement, an agreement. The EMS system, fire, kind of operates the same way. Is if you can't provide mutual aid, you can't, but their goal is to try to, provide mutual aid in every instance, but it's a informal agreement, it's not mandatory. And when you provide mutual aid, the initial, concept, the initial understanding is you're doing it free. You're providing mutual aid for free. We get mutual aid requests consistently we're part of Region 4, Medical Health Mutual Aid Region, which mirrors the fire. You guys are Region 4 mutual aid as well. So there can be agreements and things in place, but mutual aid is voluntary and it's free unless there is some kind of agreement in place for compensation.
Is that something that you can pursue? I'm just asking out of more curiosity, or just,
We will pursue them if the parties are willing, but we can't force it because again, mutual aid is voluntary. Now, the fire system's a little bit different, but in terms of EMS, whenever we get a request, we put it out to all of our providers, whether it's Mercy Ambulance, ALA, Ebbets Pass Fire. The reality is, as much as they may like to provide ambulance mutual aid, they don't have the resources. Their hands are pretty full of the 911 system alone. And then the interfacility stuff. We do have contractual agreements with 2 interfacility providers. We accept applications all the time from interested parties, or we'll send the application process out. But for them, it's a business decision.
Sure.
And call volume and the number of transports that they're going to get is huge. But in every one of those agreements, they all understand legally, according to our contract with ALA, that it's basically the right of first refusal for ALA. And ALA in the past has turned down, they can't do a transport, and ALA has actually called ambulance providers on behalf of the agency to find us someone to cover their call. So, like it or not, in terms of the hospital too, I can't speak for the hospital. I did work for Kaiser ED for a while. Monetary considerations, financial considerations are huge. You guys see it at the county level. So we do look for other resources, but at this point, that exclusivity was grandfathered in according to the EMS Act in 1981. It's a legal constraint. I mean, litigation.
so I was thinking maybe it's revenue opportunity in certain areas, also just the general public safety, and I mean,
So our contract says that we will provide mutual aid to adjacent counties, and if you look at Amber County, Calaveras, we cover that, so.
yeah, that's, well,
But on the other side too.
I'm in
But
Sacramento,
San Juan
that way.
County,
Yeah.
we do have a mutual aid agreement with AMR. It's quite old.
Yeah.
I can look at that. Sacramento will not sign a mutual aid agreement with us because they don't deal with private companies.
Okay.
In El Dorado County, I've never been able to get one. In Alpine County, it doesn't.
There are some places where we're definitely the nearest thing to, they're helping them and vice versa.
Right. El Dorado, we used to bounce back and forth, but they had Diamond Spring Station 49 shut down for a while. I think that's back open now. Is that back open?
I think.
Yeah, I think it is.
It's just reopened.
But we get their medic engine out of Latrobe all the time.
Yeah.
And then Station 59 out of Rancho Marietta, they're coming in.
Yeah, that's where I was actually thinking of, was
Yeah.
Rancho Marietta, just because right there, I know 104 heading towards, Don Twin Cities Road, we're the nearest response for a very, very long way. I'm
Right.
the Herald or Gulf probably.
Yeah.
Well, we had a fire there a few years ago where my neighbor actually responded to it. He was out there in 10 minutes. They didn't get there for almost 30 just because of the location, because of the county. And so, yes. All right, thank you.
Yeah, and there's times, when vehicle accidents get called in on that road, they don't know if they're in Amber or
Oh, they don't.
Sac, and they dispatch both, and
Stephen, it's so tough.
All right, thank you guys. I'm sorry.
Yep.
Good to meet you again.
Anything else? Questions? No? Okay, thank you. Here.
Thank you.
Thank you.
Okay, need a motion to approve.
I'll move then. Have this, I'm sorry.
Oh, no problem.
Dominic Marino, Sutter Creek Fire. A couple things is, I understand concerns. We all have concerns. Part of what we did with the revamping board is try to be more reactive, more proactive versus, following everything. We had a meeting last month with Mountain County. Dr. Freeman was there. Very good meeting. We're all looking how to improve, make things better. So I think part of the discussion was, I think everybody's talking the same thing, but on a different page. So I think the understanding is, yes, everybody's looking at how to make the hospital more efficient with the transfers. We're trying to figure out how we get our medics off scene quicker so they can get patients to the hospital back in the system faster. We're all looking at things like that. So, and the fire side, we're basically here to support everybody and try to make things easier, faster. And ALA has been a bedrock. Sutter Amateur is a bedrock. The fire service, Mountain County is leaner, but they're meaner now. Got rid of Stanislaus County. So they were very active towards trying to do more things. We're talking about getting glucagon and maybe locks and maybe 12 lead stuff pushed down to the BLS level, which would be awesome. Give us more tools out there so we can maybe we can treat people better, right, where they need to go. So I understand, that there's concerns, and I think all those concerns be worked through. No problem at all. It's just a matter of sitting down and talking about it. So, thank you.
Thank you. Anybody else?
I'll move that, we approve the annual report and forward the 5-year extension to the Board of Supervisors.
I'll second.
Second by Justin. Any further discussion? All those in favor?
Aye.
Any opposed? And I abstain. For the record. Okay, moving on to item 10, financial report. Lindsay's here. Heather, you want to go over that, or? I got it. I got the digits. All right, financial report. Right now, the Matty Fund EMS funds are sitting at $22,341.51. And we've been averaging right around $1,800 a month as far as revenue coming in. So that was that report. And then we have a Matty Fund request from Amateur Fire Protection District, $1,250 for FCC licensing for the Amateur Command to increase the power input at Mount Zion. Is that just for the one site? Or is it?
Actually, what this request is for, we have to get the license increase from FCC, and this will allow us to potentially increase the wattage at all of our repeater sites. So it's not just one, but we'll start with basically Mount Zion, and it's going from a 50-watt repeater, hopefully to a 100-watt repeater, which will help out because we have a lot of dead spots in the county.
Right, right.
Can you, for the rest of the board, how many repeaters we have throughout the county?
So we have Tone 12, which is in Part E, Tone 14, which is at the Cal Fire Training Facility, Tone 11 is Mount Zion, and Tone 10 is Lake Springs. Thank you.
How is the interference? Was it with Yuba City?
I think that's all but gone now.
That's all changed. They changed our channel, so
Nice.
that goes.
Okay.
And that's just the fee for the license to allow us to go to 100 watts. That won't include increasing the wattage, correct?
Yes, this is just the fee for the FCC, and then we'll have to buy the equipment.
Yep. Awesome. Have a motion? Need approval?
Move to approve the request for reimbursement to the Amateur Fire Protection District and the amount of $1,250. Second.
Any further discussion? All those in favor? Aye. Any opposed? So moved. And local CQI committee reports. Mr. Ferreira.
As I was scribbling furiously here. As Tom brought up with our simulation mannequin and our mobile sim lab, we were looking at rolling out trainings here at the beginning of January and then January 7th, because our winter months are the good months when the firefighters aren't out fighting fire. That didn't pay off so well for us this January, so we're looking into February and March as far as rolling those out, getting Tony out to different firehouses. We're also looking at bringing the resuscitation academy somewhere somewhat local, which is hopefully going to roll out a high performance CPR train the trainer. So I know it's been a minute since we've seen one of those here in Mountain County's EMS agency, and we're really working hard and pushing to do that. We are going to have to change our continuous quality improvement meeting dates. Currently, it's the second Thursday of the second month of the quarter. The NorCal LEMSA QI committee has decided that that's a good time for them to meet. And I really need to be in those meetings. So we're going to look to shift ours to the third month. So look for that invite in March. Sutter Amador Hospital has been doing call review for the Amador personnel, and that's been a huge help. Not only it's just another addition to our CQI process. It's been hugely helpful. Before I call Dr. Freeman up to talk about Title 22, I would like to publicly thank all of the Amador Fire Protection Agencies for sending units over this Saturday to cover Calaveras while they have that funeral for the firefighter that was killed. So thank you for that. And now, Dr. Freeman, because she knows more about Title 22 and some of the changes that are coming.
Good morning. So you may have heard that Title 22 is opening up the regs. That's kind of the word on the street. What they're doing is a complete revamp. Everything that's in there is being rechaptered, reorganized, and looked at. These are unusual opportunities to look at them and provide feedback. Currently, the personnel chapter is being revised and should be open for public comment soon. I'm not aware of a way that you can be on like an invite list. But if you check the California IMSA website, it should be out for public comment soon. The general gist behind what California is trying to do is align with national scope. So what is coming up is EMT, advanced EMT and paramedic scope of practice regs to advance the scope to align with what we see in the nation. I know that's been a dearth in California for a long time. So be ready to look at that. All of the other regs are going to be opening too over the coming 18 months, which are opportunities for us to provide feedback. We in EMS Medical Directors Association of California often provide the feedback first. So that was solicited from us a week and a half ago. I expect that the personal regs will be open for public comment soon. Any questions about that?
Appreciate it.
And just to allow you some knowledge of what that means too, we have always been very proactive about getting the best local optional scope options, which often are special application to the state. Some of those things are going to become standard scope. I'm kind of holding back on what new we're going to roll out until I see what standard scope is going to be, and then we'll continue pushing our scope of practice so we can best serve our rural community.
Thank you. Okay, we're moving on to agency reports. EMS agency, you have anything else to report?
One thing, Alan,
Please come to the mic.
Okay. One thing to report, we are going to be floating a job flyer. Our emergency preparedness coordinator resigned. He will be gone at the end of next week, so we will be flying his job. It will be, unless we make any changes that I don't project, it will be looking for someone with a minimum of an EMT certification to work with the facilities, public health primarily, and the hospitals, emergency preparedness, surge, evacuation, all that kind of stuff. And the fire guys too, because we always need guys to be calm people. But so it's a 40-hour a week, so it's a, one FTE. So that should be coming out soon. So in the short term, I guess I'm gonna be the contact for that, since that's where I came from, so, but that's really it. Thank you.
Thank you. And then, I'm gonna let Mr. Gerton go here for, OES fire. He's gotta run to another meeting.
Yeah, I apologize for going out of order. From the OES side of the house, just to remind everyone that as of January 1st, Code Red is formally no more. It's Amarillo County Emergency Alerts. If you haven't signed up for that, I encourage you to go to the Sheriff's Office website and please pass that on to the people that you serve. As I think most of you guys know, the county contracted with Foster Morrison to update the local hazard mitigation plan. In December, we held our first hazard mitigation planning meeting, which was very well attended. Since then, we've identified 8 participating jurisdictions, which are all of the 5 incorporated cities, plus the Amateur Water Agency, the Jackson Valley Irrigation District, and the Amateur County Resource Conservation District. All 8 of these participating jurisdictions will have their own annexes in the plan, which makes it as much their plan as it is the county's. And it means that they will be eligible to apply for pre and post disaster mitigation grants through FEMA. Our next meeting is scheduled for April 9th from 1 to 4 right here in this room. And that's it for the OES side of the house. On the Sheriff's Office side, speaking for Lieutenant Jeff Bellotti, he asked me to pass on. Last week, our SWAT team responded to an incident, a mutual aid incident over in Calaveras County, as did probably about a dozen other agencies. And we'll be seeking reimbursement for that through the Callaway SLIMA. And that's all I got. Thank you.
Thank you. Ambulance, I don't have anything. Air ambulance not here, Cal Fire not here, CHP not here. Fire departments or districts. Anything to report? Anybody? Public, police departments, public health.
Right. The only thing that I have to report is, we held our community preparedness, coalition meeting last Thursday. And in that, we went over the top 10, hazards, we require as part of the, hospital preparedness program grant. That annually we do this survey within Amarillo County to our stakeholders. And then we go over those results at that meeting. There was some interesting top 10 results in this year's previous to prior years. So I just want to go over them very quickly. For those of you that do not know what a hazard vulnerability assessment is, or a survey for that, basically it helps us as a community and county outline some of the resource challenges, emergency preparedness trainings that, you know, we could benefit from as a community, and really just kind of giving the state direction as to where our rural county is with these preparedness and resilience opportunities. So the first one, the top of the list was fire, external, temperature extremes, communication failure, hostage situation, supply chain failures, active shooter, earthquakes, evacuations, inclement weather, and utility failure. That is all.
That's enough. Thank you. Sutter Amateur Hospital. Nothing to report, all right.
Oh, can you hear me?
Supervisors.
Oh, can you hear me? I am on the line. This is Rachel Dimmer, the Health and Safety Specialist.
I'm not sure.
So we are currently working on updating our access control policy and procedure.
Go ahead, Rachel, when you're ready, please.
Oh, can you hear me? we had an event earlier this year that exposed some gaps in our current policy and procedure. So, we will be running
We're
some
unmuted on our end, but we're unable to hear.
during, sure. Thank you. I'm sorry, did you say something?
It looks like she's thinking about it.
Okay.
If you're unable to speak on your end, you can email anything that you'd like to state, and we can include that in the minutes.
Sounds good, thank you.
Well, we'll move on to Board of Supervisors. If she comes through.
I don't have anything.
Nothing.
After everything else we've been going on. The one thing I do recommend, if anybody wants to know more about, ALA is, Caleb, his last name, user. He does an excellent, presentation, PowerPoint presentation of ALA's finances and all that type of information he does. He's done it quite a few times for the Commission on Aging, and I've listened to that, and it's eye-opening. It's an eye-opening presentation that you like.
As annual report.
Annual report, yep. That's it.
All right. Report. Nothing to report. No, yeah. I've been here like 2 weeks, haven't you? I'll figure it out. Welcome aboard. Thank you. All righty. Nobody else has anything else? We will adjourn the meeting. Thank you.